one of the procedures that has been proven in terms of its effectiveness through various studies and identified to be evidence-based in research compilation study reports is prompting. McClanahan and Krantz defined prompts as instructions, gestures, demonstrations, touches, or other things that we arrange or do to increase the likelihood that children will make correct responses. Prompting is often used by educators and paraprofessionals in order to encourage a correct behavioral response from a student. It is important that the used prompts are clear, consistent, and directed towards the student. According to Kara Hume, there is an evidence base that supports the use of prompting with students on the autism spectrum. Prompting is appropriate across most educational settings. Hume mentions that prompting is easily applicable in a classroom setting with one or more students with ASD. When teachers want to teach new students a new task, they may use prompts to help students be successful in what they are learning and doing. There are many different types of prompting that you, as a paraprofessional, may be asked to implement when working with students with ASD. These include, but are not limited to, least to most prompting, simultaneous prompting, and time delay. Least to most prompting is fairly simple to implement with children with ASD and use in the classroom context. Least to most prompts include a visual prompt, verbal prompt, gestural prompt, modeling, partial physical prompt, and full physical prompt. You will want to begin with the lowest level of prompting and only proceed to prompts that offer more assistance if students are not successful. There are 4 simple steps to follow when implementing least to most prompting. First, you want to select the target skill that you are going to be working on with the student. You need to decide what type of prompt should be given: a visual, verbal, gestural, modeling, partial physical, or full physical prompt. If the student responds correctly after the cue or instruction is given, he or she should be reinforced. If the student responds incorrectly, provide additional prompts, ensuring that the students will eventually succeed. In a 2017 study, Fink et al. Found that least to most prompting was effective for teaching school-age children with ASD to use multi-symbol messages during storybook reading. A second type of prompting that you may be asked to implement as a paraprofessional are simultaneous prompts. You will first want to provide a controlling prompt immediately following the cue that you have given. A controlling prompt ensures that the student will give the correct response. For example, you may ask the students, "What is this?" and you immediately answer, "A teddy bear." Your response with the correct answer is the controlling prompt. Simultaneous prompts are effective in teaching discrete skills such as pointing out the numerals, learning the names of relatives, reading words, and in teaching chain skills such as preparing fruit juice from fruit juice concentrate, locking and unlocking closets, leisure skills, and hand washing. Finally, you may be asked to implement time delay. Time delay is a practice that focuses on fading prompts during instructional activities. This is used with other prompting procedures. However, a brief time delay is provided between the cue and any additional instructions or prompts. There are 2 types of time delay: constant time delay and progressive time delay. Constant time delay is a constant time period of wait allowed for the individual to respond after the target stimulus is presented. Discrete skills that can be taught using constant time delay include, but are not limited to, learning the names of capital cities, learning the names of animals and clothing, reading words, and recognizing informative boards. Chain skills can also be taught using constant time delay. These include, but are not limited to, aquatic play skills, preparing food and drinks, shopping skills, free time skills. When using progressive time delay, the delay period is progressively increased. For example, you allow a 2-second time delay the first time you prompt a student, but then a 4-second time delay, and then a 6-second time delay subsequently. This concludes includes your training video on the evidence-based academic intervention of prompting. Here is a list of reliable and educational resources that you can use if you would like more information on the use of prompting, or other evidence-based interventions working with students on the autism spectrum. It is undoubtedly clear that prompting is an incredibly effective, evidence-based practice that can be utilized when working with students who are on the autism spectrum. However, when implementing prompting, you must be sure that the procedures are enabling learners to respond to relevant environmental stimuli. This is vital so that a dependency on the prompting cues is not developed. If prompting is successful, then students will be able to demonstrate taught behaviors or tasks without the previously needed prompts and will be more likely to successfully demonstrate them across all settings.